Hello, I'm Brenda King, Nurse Consultant in Tissue Viability. This is the second part of 2 modules. In Module 1, we considered wound healing and the reasons why wounds stalled, focusing on a molecular level, and identified that the macrophage is the strategic cell in wound repair. In Module 2, we're going to look at a new product, bioactive beta-glucan, which is capable of activating the macrophage cell. There is a potential for a product to actually target the macrophage in stalled wounds. It will restore their functionality and resolve the chronic inflammatory state, and thus restart the healing process. This is using a product that contains beta-glucan. Beta-glucan is a long-chained polysaccharide molecule, which naturally occur as structural components in the cell walls of grain and fungi. Their structure gives them a molecular motif, known as a pathogen-associated molecular pattern, or PAMPs. Our innate immune system recognises these structures, or PAMPs, as danger signals, and the macrophage will attach themselves to the beta-glucan. There are specialised receptors on the white blood cell. These recognise and bind to the beta-glucans. Receptor binding results in the activation of cells and the subsequent production of signal molecules and growth factors. This allows the macrophage to become more developed into a more mature stage that facilitates the healing process. When the macrophage is activated by the beta-glucans, it improves the effectiveness of the macrophage in its wound cleansing and debridement. Its phagocytosis is improved, and there is improved removal of dead cells and bacteria from the wound bed, including senescent cells. Therefore, it assists in the resolution of wound inflammation. It reduces the number of neutrophils in the wound bed. This allows the right expression of growth factors, supporting cell proliferation, angiogenesis, and deposition of extracellular matrix. It promotes wound closure as it releases cytokines which encourage myofibroblasts into the wound, which bring about contraction, and there is improved reepithelialization of the wound surface. By activating the macrophage, which plays a central role in wound healing and orchestrates the wound healing process, this actually promotes wound healing. Woulgan Bioactive Beta-Glucan Gel is a gel with all the hydrogel properties that clinicians are familiar with. It provides a moist wound environment, therefore supporting autolytic debridement. It's soothing and provides pain relief and has a slightly acidic pH. So what makes Woulgan unique is an ancillary component which activates the white blood cell, in particular the macrophage. And it increases the macrophage's phagocytosis and release of important signal molecules and growth factors. Woulgan demonstrated, through a published randomised controlled trial, improved outcomes at a reduced cost, where 2.3 times more patients healed at 8 weeks, with a continued improvement to 12 weeks. On the right in the slide, when compared to the standard of care group, the Woulgan group demonstrates a €740 cost saving per patient. I will now present 2 cases taken from a recent evaluation of 26 patients using Woulgan Bioactive Beta-Glucan Gel, where 7 patients healed. All the patients had had stalled wound for at least 4 weeks, with some many months and even years having had a chronic wound or stalled wound. The first case is a 49-year-old male patient who was a diabetic, receiving metformin and also on simvastatin. He had a right forefoot amputation in 2010, and the wound failed to heal after 6 years in duration. He had no evidence of arterial problems, but had neuropathy. The wound was initially dressed with Woulgan 3 times per week and then twice weekly. The wound was considered healed at week 9. The second case study is a 76-year-old female who contracted polio as a child, which affected her right arm and leg and resulted in an altered gait. She also had a history of angina, for which aspirin and statins had been prescribed. While walking her dog, she went over on her ankle and suffered a compound fracture to her tibia and fibula in October 2015. This was surgically fixed with pin and plate, and initially she was treated with reduced compression for a degree of associated venous hypertension. She was referred to the tissue viability nurse in April 2016 as the wound was failing to progress, but had been in this state for a few weeks previously. She was treated with Woulgan and the wound was considered healed at 6 weeks. In this second and final module, we've looked at Woulgan bioactive beta-glucan gel. We've been able to demonstrate the results of a randomised controlled trial where improved outcomes at a reduced cost were achieved. And we've also demonstrated in clinical practice with 2 case studies improved outcomes and healing in 2 patients with stalled wounds. As a conclusion to this webinar and to aid reflective practice, based on your clinical experiences in the past 3 months, think of a patient whose wound has stalled and identify 6 patient-related, wound-related and non-wound treatment-related factors that contributed to the wound chronicity. Explain why macrophages promote healing in acute wounds. Explain what happens to macrophages, growth factors, and matrix metalloproteinases in stalled wounds. Describe the wound bed characteristics you would expect to see in a stalled wound. Why is it proposed that a treatment strategy that targets macrophages might help promote healing in stalled wounds? Describe the function of beta-glucan.